Our top story at the bottom of the hour, House Democrats have unveiled their health care reform bill, a mix of the Senate version and desired fixes. But there is a move afoot in many states to try to shut down the bill before it's even passed. Correspondent Shannon Bream explains.
With the stroke of a pen, it became official in Idaho. Governor Butch Otter signed a bill requiring the state's attorney general to sue the federal government if the health care measure that mandates that individuals buy health insurance passes.
There is no authority that grounded in the Constitution for the Congress to do what they're trying to do. That's what I'm saying.
Virginia may not be far behind. Its attorney general, Ken Cuccinelli, has announced he will also file suit if Congress approves the health care measure. And it looks like he'll have plenty of company. Florida Attorney General Bill McCollum has sent a letter to the National Association of Attorneys General saying, quote, I invite you to join me in preparing a legal challenge to the constitutionality of whatever individual mandate provision emerges immediately upon the legislation becoming law. Despite growing opposition, the White House remained confident Thursday.
The president and the team believe strongly that what we're about to pass and sign into law will meet constitutional muster.
But in addition to those states considering lawsuits, many others are opting for a different legal maneuver altogether, working toward amending state constitutions to make it illegal for any government entity to require that individuals buy health insurance. Not only the federal government, but also the state government, like the requirement under Massachusetts health care reform.
They don't want that in their state, and if the state passes a constitutional amendment, it would make that unconstitutional. The icing on the cake is that it would also provide protection against any kind of federal action similar to Romneycare.
And it's not just the individual mandate that states are rejecting, but also the mandates for the states themselves. Arizona's governor has sent a letter to President Obama and congressional leaders objecting to benefit exchanges, which would require states to enact specific legislation to set up the framework or allow the Secretary of Health and Human Services to do it for them. That, Governor Brewer says, is in direct violation of the 10th Amendment. In Washington, Shannon Bream, Fox News.
President Obama will travel to